Welcome, everyone. We'll be starting at 2 p.m. For everyone just joining, we'll be starting at 2 p.m. For everyone just joining, we will be starting at 2 p.m.
Hi, everyone, and welcome. We'll get started in 1 minute. Hello, and welcome to the Housing and Services Partnership Accelerator application briefing for states. Thank you so much for joining us today. Next slide. My name is Ryan Elza, and I'm the Interagency Housing Innovation and Strategy Lead within the Office for Interagency Innovation at the Administration for Community Living and Operating Division within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar, and it's a privilege to have so many of you here with us today. Next slide. First, a few housekeeping items we want to address. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees have been muted for audio quality. One hallmark of our webinars is an active participation from attendees. Feel free to introduce yourselves in the chat, and please frequently use the chat to make the comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. Or you may email a question or comment to hsrc@acl.hhs.gov. We reserve time to address your questions at the end of today's presentation. You can also use the chat or email if you have a technical issue or comment for other attendees. Finally, near the end of the webinar, we'll be using both QR codes on the screen and links in the chat to share some resources, so consider having your phone handy. After the webinar, we'll email the slides and links to everyone. Next slide, please. Today, an ASL interpreter will be visible throughout the webinar. You can enlarge the window of the ASL interpreter by using the pin feature. Simply click on the ASL interpreter's window and select the pin icon to make their window larger. To ensure the ASL interpreter will be visible in our webinar recording, we have also asked presenters and panelists to limit use of their own camera visibility only to when they are speaking. For those who are using a screen reader and want to silence unwanted chatter in the chat and QA boxes, activate the speech on demand feature by pressing Insert spacebar and then pressing the letter S on the keyboard. Next slide. Now, let's take a look at our agenda. We have a lot to cover in a short amount of time. After our welcome and housekeeping, we will hear from Allison Barcroft from ACL, Dr. Richard Cho from HUD, and Dr. Jessica Lee from CMS, who will lead us with importance of the shared opportunity. We will then walk through the application to review who is eligible, the benefits of participating in this opportunity, the application requirements and process, and key dates to keep in mind as you respond to your application. We have allowed ample time for questions and answers, so be sure to put those in the Q&A box. Next slide. Collaboration across HHS and HUD with representatives from additional federal agencies have led the way for establishing this opportunity. First, we'd love to hear from Allison Barkoff, who leads the Administration of Community Living and is performing the duties of the ACL Administrator and Assistant Secretary for Aging. Allison?
Ryan, thank you so much. And thanks to everyone who is participating today, states, community-based organizations, agencies, advocates, and everyone working to make sure that affordable, stable, accessible housing is available to everyone who needs it. This is such an exciting moment, and ACL is so proud to be part of this opportunity. Since I arrived at ACL on Inauguration Day, my team and I have made housing a priority. One of the first things that I did was reach out to Richard Cho at HUD. We had worked together on coordination of housing and services in our prior roles in the Obama administration. We both saw an incredible opportunity to build a partnership from our new roles between HHS and HUD. That call led us to building and broadening our partnership. And almost 2 years ago, we formally launched the Housing and Services Resource Center, formally bringing together HUD with a number of HHS agencies, including the Administration for Community Living, the Centers for Medicare and Medicaid Services, SAMHSA, and the Assistant Secretary for Planning and Evaluation. We've since grown, bringing in the Administration for Children and Families from within HHS and the CDC, as well as bringing in USDA and building a collaboration with HRSA, the Health Resources Services Administration. So we at our core are about partnerships. The goal of HSRC has always been about partnerships and leveraging every resource we have to solve big problems. We all know that affordable, accessible housing is not only in short supply, but in many areas is close to non-existent. And for too many older adults and people with disabilities, the communities that we in ACL serve, housing is often the single factor that stands between them transitioning out of an institution and living in the community. And for many people, the lack of affordable, accessible housing too often is the reason that they're placed in an institution in the first place. Unstable housing increases the chance a person will become homeless or end up in an emergency room. And people with disabilities and older adults are a significant and unfortunately growing proportion of people experiencing homelessness. We know this is a difficult problem, but it is solvable. And it will require steadfast resolve and finding resources, and importantly, building partnerships. So that's why we are all here today, to move the needle, to spark the cylinder, and to truly get moving on affordable, accessible, stable housing for the people we collectively serve. For a long time, Medicaid has truly been a thought leader on linkages between health and social factors. And we've seen time and time again evidence that addressing social determinants of health results in both better health outcomes for people and is cost effective. Stable housing is so fundamental to social well-being and thus to overall health. We know that ensuring people have access to services and supports is critical to helping them live stably in the community too. And now we are seeing states leveraging Medicaid flexibilities to address housing needs, including through approved 1115 demonstration projects and Section 1915I state plan benefits. We see partnerships growing among agencies and healthcare and community-based organizations, including ACL's Aging and Disability Networks. And it's been incredible to see HUD putting the housing needs of people with disabilities and older adults as a priority on their agenda too. We still have a lot of work to do, but housing outcomes that once seemed unlikely and unreachable are now places where we have successful examples of collaboration we can point us to. So that brings us to today and why I'm encouraging all of you to put together your best proposal, outlining a collaboration of housing, health, disability, and aging, so you can be part of the Housing and Services Partnership Accelerator. You will hear more details from others, but I just want to emphasize that this is an amazing opportunity where the selected states will receive so much support, not only from the Housing and Services Resource Center, but be able to work with all of the HSRC federal partners, including HUD and ACL, CMS, HRSA, SAMHSA, USDA, and ASPE. But there's a catch. We need to hear about your interest in the next 2 days by November 15th, and you need to submit your application by December 1st. So thank you again for coming and for your push to us to work together, to leverage our resources, to think outside the box in how we can support you all in the states in achieving our shared goals. Thank you to all our federal partners. A big shout out to Richard Cho from HUD and Dr. Lee from CMS, who have been incredible advocates in this effort. If you are lucky enough to be part of this accelerator program, I promise you, you will have an amazing next 12 months. So I'll close by thanking you again for being here and for all you do every day to help people live healthy and inclusive lives in their own communities. And with that, I'll kick it back to Ryan. Ryan?
Thank you very much, Allison. Next, we'll hear from Richard Cho, Senior Advisor for Housing and Services from HUD. Richard?
Great. Thank you so much, Ryan. And Allison, thank you so much for those remarks. It has just been a huge honor to work in this administration alongside leaders such as Allison Barkoff, as well as Jessica Lee, who you'll hear from in a moment. But even to be on the same slide as those two incredible thought leaders is such an incredible honor. I just want to thank everyone for joining today. The fact that we have over 600 people, and it looks like growing, who've joined us today demonstrates the incredible interest there is in looking at how we can leverage Medicaid as a way to cover the wraparound services that people need to obtain and maintain their housing, and to coordinate the Medicaid-funded services with resources at HUD. On behalf of HUD and Secretary Marcia Fudge, I want to really encourage you all to apply for this incredible opportunity. We at HUD believe that the combination of housing and supportive services is a powerful tool, both for addressing homelessness, but also for helping support community living for people with disabilities and older adults. But we know the resources that the federal government provides doesn't always provide that combination of resources to pay for both housing, rental assistance, or capital costs, as well as the resources to pay for wraparound supportive services. Really, I think we rely on states and communities to be able to braid together the resources that HUD provides for housing alongside the many resources at HHS that cover supportive services. And I think what this accelerator that we're here to talk about today is really an opportunity to help you connect the dots between those opportunities. Over the last almost 3 years, HUD has been able to provide communities with historic resources to address homelessness, as well as to meet the rental assistance and housing needs of people with disabilities. For many, many years, HUD's budget has been underfunded, flat funded, or actually had our budgets cut. And so there's been a scarcity of housing resources. But over the last 3 years, we've made some progress in helping to reverse that. First, providing significant historic resources to communities to address the problem of homelessness, the resources that we provided through the American Rescue Plan. Over 70,000 vouchers and $5 billion in grants, as well as dedicated grants to address the crisis of unsheltered homelessness and homelessness in rural communities. We've also provided more housing choice vouchers in different forms over the last 2.5 years than has been actually provided in nearly 20 years. In fact, over the last 2.5 years, we've issued about 120,000 vouchers of different types to help communities to address homelessness, as well as to meet the rental assistance needs of low-income Americans. Those resources certainly aren't enough, but we are, again, making progress in helping to meet our vision to ensure that everyone who qualifies for rental assistance can ultimately get the rental assistance they need. Many years ago, communities who were struggling to address the crisis of homelessness, their number one challenge was finding enough housing resources, rental assistance, permanent supportive housing resources, or rapid rehousing programs to be able to meet the need. These days, we certainly know there's still a need for more housing resources, but most communities don't say that housing assistance is the number one challenge. Many of them say that the number one challenge is really finding ways to cover supportive services, as well as to ensure that they're hiring people and able to retain their staff. And so what's interesting now is that the greatest challenges that communities face is providing supportive services that can be coordinated with the housing assistance. Now, as Allison mentioned, Medicaid has long been an opportunity, presented an opportunity to cover those housing-related wraparound supportive services, but the degree to which Medicaid can cover those services has not always been clear. But I think through the leadership of the Center for Medicaid and Medicaid Services and Dr. Lee, who you'll hear from in a moment, there's going to be greater clarity around the opportunity to cover these housing-related wraparound services under Medicaid. And we've already had, I think, more than a dozen states who've taken the first step in covering these housing-related supportive services under the Medicaid programs, states who've obtained Medicaid waivers or state plan amendments that enable them to cover these housing-related supports and services. But really obtaining those waivers or state plan amendments, that's just the first step. The next step is really how do you actually implement those new services and benefits that are covered under Medicaid, and to do so in ways that is complementary to the housing resources that are provided, including the programs that HUD administers. And so we launched this Accelerator as a latest effort as part of this Housing and Services Resource Center as a way to help the growing number of states who've taken that first step in obtaining the waiver approvals or state plan amendments that enable them to cover these services and to actually implement those services. And not only have to do that on their own, but be able to have an opportunity to learn from one another as they're all embarking on this new journey and opportunity. So I'm incredibly excited about the Housing and Services Partnerships Accelerator. As Allison mentioned, I also encourage every state who's already obtained federal approval for a Medicaid waiver or state plan amendment that covers housing-related services to apply and to put together an incredible team working with your public housing authorities, your local continuums of care, and your state and local housing agencies, as well as your disability and aging networks within your states. This is an incredible opportunity to demonstrate that we can use federal resources to put together the combination of housing and supportive services that will enable us to make significant progress in reducing homelessness, as well as supporting the community living for people with disabilities. So again, I encourage you all to apply. We are excited to work with you as states. And again, want to just thank our partners at HHS for the incredible partnership. I'll turn this back to you, Ryan.
Thank you, Richard, very much. And last but certainly not least, we have Dr. Jessica Lee, Acting Chief Medical Officer from CMS. Jessica?
Hello, I am so excited to be joining my colleagues from HHS and HUD and welcoming you today and announcing this launch. In 2022, CMS announced a new Medicaid 1115 demonstration opportunity in addition to managed care tools to support states in addressing health-related social needs, with the goals of improving coverage, access, and health equity for individuals enrolled in both the Medicaid and children's health insurance programs. This groundbreaking framework, already taken up by 7 states through 1115 demonstrations, built on the precedent for covering certain housing and nutrition-related services under Medicaid home and community-based services authorities. We've been working to support an increasing number of state partners with designing programs, benefits, and services under these Medicaid authorities to provide a variety of housing-related services and supports to address health-related social needs of individuals who are experiencing or at risk of experiencing homelessness, intended to complement but not supplant existing social and housing services. Examples of these supports include housing transition and navigation services and individualized case management. Under these authorities, these states are able to develop innovative ways to partner with state and local housing entities and aging and disability networks to provide a full range of services and supports to ultimately improve health outcomes and housing stability for those experiencing or at risk of experiencing homelessness. This Housing and Services Partnership Accelerator is a really terrific opportunity to bring states together to learn from peers, identify resources and best practices, and receive technical assistance. From CMS's experience with other successful learning collaboratives with our state partners, such as the one on improving postpartum care, we know just how valuable this environment of facilitated peer learning can be. Creating a framework for opportunities was step one towards the goal of improving health outcomes by addressing health-related social needs. The ultimate success of this goal will be determined by the steps to come, the steps needed to realize the delivery of needed services and supports to individuals experiencing or at risk of experiencing homelessness. And these steps will be easier if they're taken together. So really excited about this opportunity and the chances that we'll have to collaborate in the future. With that, I'll turn it over to Ryan.
Thank you, Allison, Jessica, and Richard for those remarks. And we'll just pull our slides back up. To summarize, the Housing and Services Partnership Accelerator is an opportunity for states to strengthen their state Medicaid agency collaboration with agencies providing housing, aging, and disability resources and programs. HSPA seeks to help states accelerate and improve their service delivery and effectiveness at reducing potentially avoidable high-cost services such as emergency room visits and institutional care, and to improve physical and mental health outcomes for Medicaid beneficiaries. The coordination of housing assistance and wraparound support services, such as in the form of supportive housing, is a proven cost-effective approach to assisting people with disabilities and chronic and complex health conditions to transition from homelessness, exit or avoid institutional settings, and live in the community. Next slide. This learning collaborative is a technical assistance opportunity that will bring together states interested in implementing or expanding innovative person-centered housing-related activities, supports, and services to Medicaid-eligible persons with disabilities and or older adults who are experiencing or at risk of experiencing homelessness for peer-to-peer learning activities. Only states with an approved 1115 demonstration or an improved 1915I state plan amendment covering housing-related services and supports for individuals experiencing or at risk of experiencing homelessness will be accepted, and only one application from each state will be accepted. As the name suggests, the Partnership Accelerator will focus on helping states improve collaboration and coordination between organizations and systems that provide services and resources that help people find and keep stable housing in the community. This is a technical assistance opportunity for states, and funding is not available. The Accelerator will operate for 12 months, starting from January through December 2024. States selected to participate in the Accelerator will need to commit the time and resources to leverage this opportunity to its fullest. This includes a virtual kickoff, a state needs assessment so that we can fully understand the technical assistance needs for each participating state, an in-person meeting in Washington, D.C. area that will include ACL, CMS, SAMHSA, ASPE, HRSA, HUD, and subject matter experts. Note that the travel expenses will be covered for participating state team members. 2 peer-to-peer learning tracks with up to 4 90-minute sessions each. One-on-one state coaching sessions offering support from housing and services subject matter experts, and a final closeout webinar on lessons learned and next steps. States are expected to dedicate at least 1 key staff from each of their core team members and at least 1 key staff from every participating agency and organization listed on their application to participate in each of these activities. Additionally, states may want to dedicate some time in between sessions to debrief on their learnings and share with others within their state. Next slide. CMS, as Dr. Lee covered a little bit earlier, identifies the following categories of housing-related activities and supports described in the 2021 State Health Official Letter on Social Determinants of Health, which you'll find linked here, and the slides have been made available on the HSPA website and will also be emailed after the presentation. First, home accessibility modifications, which are temporary or permanent changes to a home's interior or exterior structure to improve individuals' ability to remain in their homes and communities. One-time transition costs, which are non-reoccurring setup expenses for individuals transitioning from an institutional or another provider-operated congregate living arrangement, such as a group home or homeless shelter, to a community-based living arrangement in a private residence where the person is directly responsible for their own living expenses. And housing and tenancy supports, including both pre-tenancy services, which assist individuals to prepare for and transition to housing, and tenancy sustaining supports, which are provided to an individual once an individual is housed to help the person achieve and maintain housing stability. Next slide. The housing and services, next slide. I think we want to go for the topics for technical assistance. Oh, or did I scroll? So the housing, coming to the technical assistance slide, please. Great. The Housing and Services Partnership Accelerator was established in a response to express needs from states and will provide technical assistance in a variety of topics, including but not limited to strategies for creating new partnerships, strengthening existing partnerships between continuums of care and other housing entities, aging and disability network organizations and state Medicaid agency and operating agencies, braiding funding from continuums of care, public housing authorities, Medicaid, and other funding for health and community living to link and connect people to housing resources and supportive services, to create supportive housing models, service and benefit design, payment models and rate setting, data strategies to identify, prioritize individuals for housing-related services, including establishing data use agreements and cross-system data matching, strategies to support persons with disabilities and older adults transition from hospitals, nursing homes, or institutions to stable housing in the community through aging, disability health, behavioral health, and housing partnerships, and more. The application provides a more detailed list of technical assistance topics. You are required to indicate all the topics to which you're seeking assistance through this accelerator. Next slide, which is the benefits. Participating state Medicaid agencies in collaboration with their state and local housing partners and relevant disability and aging networks will have the opportunity to expand their knowledge base around delivering effective housing-related supports and services, increasing collaboration and coordination across state and local health and housing agencies, covering resource gaps and advancing ways to deliver seamless services to individuals experiencing or at risk of experiencing homelessness, access an array of technical assistance customized to meet each selected state's needs, and support for implementing a whole of government approach to addressing housing stability. Next, on the team-based application, participating states will be required to form a core team of representatives from their state Medicaid agency, state and local housing and homeless agencies and organizations, state and local disability-focused agencies and organizations, and state and local aging agencies and organizations. States may engage with a wide variety of partners during the accelerator, but only require a few core partners for the initial application. Each state will identify a team comprised of representatives from each of the sectors mentioned with a designated lead state agency or organization. States are highly encouraged to have their state Medicaid agency apply as the lead applicant, but it is not required. If the lead applicant is not the state Medicaid agency, the lead applicant must obtain a letter of commitment from their state Medicaid director. The program overview document on the Accelerator webpage provides a list of example organizations that should be considered as team members for applications. States are encouraged to explore this list and include all that will be needed to achieve the state's goals for their participation in the HSPA. Next slide. Additional team members. In addition to required core team members, states may also include and are highly encouraged to invite eligible partners, such as their single state agency for substance abuse services and state mental health agency, community care hubs, managed care organizations, state or local public health agencies, federally qualified health centers, certified community behavioral health clinics, hospitals and health systems, behavioral health providers, community-based organizations, and other services service providers to be a part of their teams. Priority will be given to states with the most robust partnerships across state and local agencies in the housing, disability, aging, and health sectors. Next slide. The process is comprised of 3 parts related to the application. The first is to submit your intent to apply. We are requesting this by November 15th to assist with this process. To assist with the processing of your application and scheduling your potential interview. Your letter of intent will be submitted using the SurveyMonkey link provided in the application. The second step for states is to submit their application. This will also be completed using the SurveyMonkey link provided and is due by December 1st, 2023. Note that the form link requires you to complete your application in one session. Therefore, we have provided the application in a PDF that you can use to draft your response over time, attain input and agreement from partners, and approvals as needed. Once you finalize, you can then copy your responses into the form. When drafting your response, please be mindful of the word count as it will be restricted what can be entered into the SurveyMonkey. For the final step, the top rated states will be invited to participate in an individual state interview with an interagency panel of federal partners as a part of the application process. Next slide. Using information gathered from the application process, the following criteria will be used to select participating states. Evidence of well-established and currently active Medicaid, community living, and housing partnerships that provide a foundation for implementing housing-related services and supports. Approved Section 1115 demonstration or 1915I state amendment plan covering housing-related services and supports for individuals experiencing or at risk of experiencing homelessness. Clearly identified goals and detailed strategies to improve or expand housing services for states' target populations of persons with disabilities, older adults, and persons at risk of or experiencing homelessness. Clear articulation of technical support needs and the specific outcomes the state wants to achieve as with the Accelerator technical support. Designation of a staff who will serve and will have the time and resources necessary to be responsible for the day-to-day activities. Identification of a core team that includes a state Medicaid agency representative, a state local housing representative, an aging network representative, and a disability network representative. And the degree to which the team includes cross-sector representation from state and local agencies across the housing, disability, aging, and health sectors. And then next slide. The alignment of goals with other relevant housing and services activities in the state. For example, the state plan for addressing developmental disabilities, the state aging plan, the state plan for independent living, relevant SAMHSA grant-related activities, your state opioid response task force, plans to end homelessness, and so forth. Alignment of technical support goals with other housing-related activities in the state, capacity and readiness to begin working immediately upon selection for the Accelerator, and acknowledgement from your state Medicaid director or letter of support if the lead agency is not the state Medicaid agency. And finally, assurance that the team members will have sufficient time and resources for the duration of the track necessary to achieve success within this effort. Next slide. So we've covered a lot of information through both the opening remarks from our esteemed speakers and also through walking through the individual components of the Accelerator application. We'll be responding to questions that have been entered into the chat. And we know we may not get to all the questions, and there may be some questions raised that will require coordination among federal partners to develop a response. We will include answers to all questions raised today, as well as received via email in an updated FAQ that will be available on the HSRC website. The FAQs will be updated as needed, so be sure to check them as you are preparing for your response and prior to submitting your application. And now we'll take and answer some questions. So the first question we have are multiple questions related to which states have approved 1115 demonstration or 1915I state plans. So I'm going to ask one of my colleagues from CMS if they'd be able to answer the question for us live.
Hi, Ryan. Thanks. This is Martha Egan, and let me see if I can come on video here to answer those questions. And I did notice that there are a number of questions asking about whether or not we had a comprehensive list of states that have an approved Section 1115 demonstration and or an approved Section 1915I state plan amendment that are covering housing related supports for individuals at risk of or experiencing homelessness. And what we want to do is to direct you to, first of all, for you to engage with your state Medicaid agency and go directly to them, and particularly to the agencies within your state Medicaid agencies that are administering home and community-based service programs, HCBS programs. You may find these will look different and be named different in every state. Sometimes they are found under, for example, the Division of Long-Term Services and Supports, maybe under the Division of Aging. But again, we do request or encourage you to reach out to your state Medicaid agency. And then secondly, I will note that on the CMS, on the Medicaid.gov website, there are two places where you can look up by state whether or not a state is currently has an approved Section 1115 demonstration. That would be on the Medicaid.gov website under the state waivers list, and you can search this by state and by Medicaid authority. So you would be looking for the Section 1115 demonstrations. But the one thing I will note is that this website will not indicate whether or not a state is actually covering housing related services and supports for individuals experiencing homelessness. So you will have to dig into the actual 1115 demonstration application and other documents. The other website on Medicaid.gov or our webpage is the state plan amendments page. This is where you would go to look for states that have an approved Section 1915I state plan benefit, and you can search that by topic. You would probably look at the HCBS topic heading, and those will display states with the 1915I, and then search by state. But again, we really highly encourage you to work directly with your state Medicaid agency.
Thank you, Martha.
Yep.
And then I see we also have a similarly related question in which if we are a community-based organization, how can we know if our state is participating and support their application? So I would echo the same advice that Martha just gave and guidance related to understanding if your state is an approved 1115 or 1915I state amendment plan state, to also reach out to your state Medicaid agency and express your interest in collaborating and participating in their application if they are choosing to submit one, and also encouraging them to look and kind of reach out to community-based organizations that you're working with in order to help build out the robustness of your application. And let's see, what other questions do we have in the chat? So since the letter of intent is due this week, can a state agency submit its letter of intent without a foreign partnership from other state agencies? If an application is submitted, there will be a team effort with efforts with the required state agencies. So the answer is yes, you are more than welcome to submit your letter of intent now without having fully formed teams that will then collaborate to complete the application. So please feel free to submit the letter of intent as soon as possible. And one thing that we'll be doing on the back end is as different states and organizations and individuals are submitting the letters of intent, if we notice that there are multiple letters of intent per state. We'll be, looking to do a little bit of matchmaking and helping to encourage folks to know that there are multiple organizations and agencies who are interested in submitting the application. So please submit that letter of intent as soon as you're able to, and continue to then work out and build your application as a part of that team. Can you provide more information around the needs assessment component? Yeah, happy to provide a little bit of additional information, and I might actually ask my colleague, Lisa Kaufman from HUD, if she would like to answer that question.
Yeah, absolutely. Thanks so much, Ryan. So as part of the Accelerator, states that are approved will be matched with an incredible technical assistance provider. And the first step will be for the TA provider to meet with the state team and conduct a needs assessment, get a lay of the land of the items listed in your plan, get a lay of the land of the team members and what everyone brings to the table, and get a lay of the land on what the state hopes to accomplish as a result of participating in the HSPA. So the needs assessment will really be a deep dive with our TA provider and the state to extract out what your needs are, and what the TA provider should focus on over the 12 months of the Accelerator. So I hope that answers the question.
Thank you, Lisa. And then we have a question from Megan. When we are talking about people with disabilities, is that all disabilities as defined by ADA, which would include substance use and mental illness, or is this restricted to developmental and physical disability? And the answer is we're talking about all people with disabilities, as all disabilities as defined by the ADA. So we have a question at how large a group are you looking for? There is a ton of interest in Washington and a very brief timeline to submit the application. Also want to make sure we have a manageable group. Great question. So we are encouraging applicants to have a wide range of representation as a part of their application. So the core requirements are just having representatives from each of the four sectors that have been outlined as a part of the application process. But we really are encouraging states to have robust teams. And we understand that there's a fine line between kind of building an inclusive, robust team, but having too many participating stakeholders to make it a manageable and actionable initiative. So we are leaving that up to states to kind of decide what will make the most sense for them in order to build the most robust team that they feel can get them to meet their goals and objectives and planned activities. So we're encouraging as much representation as possible, as in line with what is also manageable from the state's perspective. Can you share more information on the respective roles that state Medicaid, housing agencies, and aging and disability networks will play? And I'm going to actually ask my colleague Lori if she would like to take that question.
Hi, Ryan. Thank you all so much for this great question. Hold on, I'm getting some feedback. Okay. Thank you for this great question. And the state Medicaid agency is the entity within the state that would have the approved 1115 demonstration and or the 1915I state plan and responsible to administer that. So they're a really key player in this work. In addition, the state housing agency, if you have one, can play a critical role on how housing is administered within the state. And then the state disability and aging organizations really play a key role in reaching the aging population, the population of people with disabilities, and helping them get connected through partnerships to service providers and also to housing entities to be able to stay stably housed in the community. A lot of the area agencies on aging, centers for independent living, aging and disability resource centers also work collaboratively with hospital systems and managed care organizations to help people access the services that they're looking for to stay stably housed in the community, or to transition out of institutions back to the community. Or they may have partnerships with continuums of care where they're working together to help people transition from homelessness to permanent housing in the community. So all of these organizations have partnerships at the state level as well as like the local community level. And we encourage applicants to really leverage these partnerships across the states. And the state substance abuse and mental health administration agencies are also very important in this work. And we encourage the partnerships to include them.
Thank you, Lori. Could this be used to enhance what we are currently doing, or is this only for states who have not yet launched the Medicaid service? And I'm going to ask my colleague Martha if she wanted to jump in to answer this question.
Sure, thanks, Ryan. This would be for states, right, that are currently have an approved Section 1115 demonstration. So they've kind of gone through the benefit or the Section 1959 state plan benefit. So these states have already kind of gone through a planning and design phase. They may not have yet actually be implementing their approved Section 1115 demonstration or 1915I. They could be in that category. They've been approved for it, but they're in the process of working towards implementation. And then, of course, we certainly would welcome in any of those states with those approved authorities targeting individuals experiencing homelessness and also delivering housing related services and supports, that want to enhance, improve those services as well. So you may be in a pre-implementation phase and also currently implementing the housing related services and supports under those two different Medicaid authorities.
Thank you, Martha.
Yep.
Can you please clarify for the two peer-to-peer learning tracks? It says each consists of up to 4 90-minute sessions. So will there be 8 90-minute sessions total in addition to the kickoff and the needs assessment, et cetera? The answer is yes. There will be up to 8 90-minute sessions that will be a part of those peer-to-peer learning tracks. Is there any provision for our tribal nations /638 programs? And I'm gonna ask Martha to come back and address that question.
Thanks, Ryan. I would say that certainly the tribal nations and members of a tribe certainly could be partners in this effort. And again, I think you need to look at what the state is currently working on within their Section 1115 demonstration or their 1915I state plan amendment. And certainly look at opportunities to collaborate and join as part of that team. And certainly, others could weigh in from other agencies as well.
Thank you, Martha. Any other folks would like to weigh in on that question?
Ryan, this is Lori. I just wanted to encourage the tribes to work with the states and leverage any opportunities there could be. The tribal organizations also, there are over 260 area agency on aging that do serve tribes. So we encourage any states where they may have tribes within the states to reach out to those AAAs and include them as needed.
Thank you, Lori and Martha. HUD housing question. When you say housing agency, are you stating that the state housing finance agency must be a part of the team? I'll ask Lisa Kaufman from HUD to answer that question.
Hi, so we're when we talk about housing and homeless agencies, we are suggesting the types of housing agencies that should be included in your state plan. So that could be your local HFA, it could be your COC programs, it could be public housing agencies, and it could be any homeless assistance programs, could be your local municipal and county government housing agencies. So these are all suggested housing agencies to reach out to, but we're not mandating that your HFA be part of your state team. So I hope that answers the question.
Thank you, Lisa. So we have another eligibility related question that I'll ask Martha to jump in on. So what if your state has an 1115 demo for HCBS services and a 1915 approval, but none of these waivers specifically address housing services for the formerly homeless, disabled, or seniors? Are these states eligible to apply?
So the eligibility criteria for a state to apply is that they do have to have an approved Section 1115 demonstration or Section 1915I state plan amendment that is providing or covering housing related services and supports for individuals who are experiencing or at risk of experiencing homelessness. It sounds like, that question, it sounds like that your particular state has an 1115 demonstration, right, but may not be but is not currently providing those types of service, the housing related services and supports. And if that is the case, then that state would not be eligible to apply. So the criteria again is that the state does need to be covering housing related services and supports, and also targeting individuals experiencing or at risk of experiencing homelessness under those two Medicaid or under at least one of those Medicaid authorities. I hope that answers your question.
Thank you, Martha. Let's see, what other questions do we have? So we have seen a number of different questions related to funding associated with the Accelerator. So just want to reiterate that this is a technical assistance opportunity for states and that there is no funding that is being provided through the Accelerator, but each state that will be participating will receive technical assistance coaching as a part of the initiative. So we have a question of, do the supportive services have to be in a permanent supportive housing setting, or can it be provided in a scattered site scenario with formerly homeless who do not qualify for public or for permanent supportive housing and or do not need a higher level of service, but rather a lighter touch services? So I'm going to ask my colleague Lisa if she wants to hop in here, and then maybe ask Martha to follow up.
Actually, Ryan, I would if we could have Richard take the first stab at that.
Sure. Richard?
I can try. I think the short answer is no. We're not specifying that the housing that these services have to be delivered in would be in site-based permanent supportive housing only. They can be, but they can be in scattered site settings. You can coordinate wraparound supportive services with short-term rental assistance, such as rapid rehousing. You can coordinate wraparound services with housing vouchers, which don't have to come with services. So the idea actually is, let's not think about permanent supportive housing as a kind of set model, but let's think about how to create supportive housing with lowercase s and h, where we're actually talking about the coordination of Medicaid covered housing related services and a variety of different types of housing and services. And part of the implementation assistance here will help states to determine how best to do that in each of their contexts, given the kind of housing resources they have and the way that they're designing their Medicaid funded services.
Thank you, Richard. So can a state request a 1115 demonstration to provide Medicaid approved housing support and services during the year of this special TA? Martha, did you want to jump in for that question?
Yeah, sure. So can a state certainly, can be working with CMS, right, on a section 1115 demonstration. But in terms of this accelerator opportunity, this technical assistance opportunity, the state would need to have an approved section 1115 demonstration. And we know there are a lot of states out there that are in the process of thinking about planning and actually currently working with CMS. And that's what we find, really exciting about this opportunity. We're going to be working with the states that have approved section 1115 demonstrations and section 1915I state plan benefits right now, but knowing that there are a lot of states in the pipeline and that we're really hoping that this technical assistance, we can share the learnings with those states that are thinking about doing this, or with those states that are actually very close to getting an approved section 1115 demonstration or 1915I to provide the housing related services and supports. So I think, we see opportunities for all states in this accelerator program, but, we will be working directly with just 4 initially, and then hoping to share a lot of the learnings.
Thank you, Martha. So is the letter of intent, the LOI, required? While we strongly encourage states to submit a letter of intent by November 15th, 2023, it is not required. And it can be submitted any time up and through the application deadline of December 1st. Let's see, I think we have time for 1 or 2 more questions. Are there going to be ongoing reporting requirements or expectations at the conclusion of the TA period? And I'm going to ask my colleague Lori if she would like to take that question.
Hi, Ryan. Could you repeat the question again? I'm sorry.
Are there going to be ongoing reporting requirements or expectations at the conclusion of the TA period?
So the technical assistance period, the requirements are that the states and their partners across the state that participate in the learning or in the accelerator would participate in the technical assistance activities. We're planning to harvest some of the solutions that we find and items through issue briefs or toolkits. And we also are planning to host 2 webinars throughout the course of the accelerator. So we encourage states And there are partners that apply for this opportunity to fully participate in the technical assistance activities, including the needs assessment, the learning tracks, in-person convening and webinars, and help us with the issue briefs. So I hope that answers the question.
Thank you, Lori. And with that, we'd like to thank everyone for your interest and great questions. And that will conclude the quick Q&A today. So as I mentioned, we will be updating the FAQs to respond to the questions received today. You may also continue to submit questions using the HSRC mailbox, which is hsrc@acl.hhs.gov. And these resources listed on the slide, which include the overview of the Accelerator, the application worksheet, the LOI, the application for the Accelerator, and the FAQs will be available to you in preparation of your application. You can use your phone to scan the QR code in order to directly link to those, and be sure to visit the page frequently as you prepare your application to check for updates to the FAQ. A recording of today's webinar will be posted to the Accelerator webpage, and we will continue to make information available to folks as new updates come along. Next slide. In reviewing these key dates, we are requesting the letter of intent by November 15th in just 2 days as the kind of priority submission there. Your application is due December 1st. We will schedule interviews with the top rated applicants for December 6th through the 14th and intend to announce the selected states by December 21st. We will be coordinating with the selected states to schedule the Accelerator kickoff meeting in January. And the next slide. Please visit and bookmark the Housing and Services Resource Center, or HSRC, which was launched in partnership between the U.S. Department of Health and Human Services and Housing and Urban Development. And the Housing and Services Resource Center fosters cross-sector collaboration between the organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and supportive services. The HSRC is a part of an interagency initiative to streamline and expand access to affordable, accessible housing and the critical services that make community living possible. The HSRC website is at acl.gov/housing and services. Thank you to all of our speakers and participants today. We look forward to receiving your applications and hope you have a wonderful rest of your day and week and holiday season.